We're good. Roll.
All right, good afternoon, everyone. This is the April 9th meeting of the Maine Recovery Council. Now that we have a quorum, we can go get started. My name is Tess Parks. I'm filling in for Pat Kimball to chair this meeting. We do have a number of folks that are not able to attend, but we'll get started with introductions with folks online, and we'll start with Sheriff Brackett.
Hey, good afternoon, everyone. My name is Todd Brackett. I'm the sheriff in Lincoln County.
Amber?
Hi, everyone. My name is Amber Pulsifer. I am an individual in long-term recovery. I'm also an LADC, CCS, and I am the clinical supervisor at the Comprehensive Treatment Center in Presque Isle.
Liz?
Hi there, Liz Blackwell-Moore, she, her pronouns. I'm the director of Cumberland County Public Health.
And Joe?
Hello, everyone. My name is Joe Everett. I'm the president and CEO at the Opportunity Alliance here in South Portland.
Brendan?
Brendan O'Neill with the Maine Attorney General's Office.
Great, and we'll return back to the room starting with Deb.
I'm Deb Poulin. I am the clinical director and acting deputy director of the Office of Behavioral Health. The council.
I'm Paul Wetzel. I'm a addiction medicine and emergency medicine physician, live in West Bath.
I'm Katrina Bonish. I'm with the Attorney General's Office.
I'm Elizabeth Forder. I am the coordinator for the Maine Recovery Council.
Chastity Toole, executive director of the Maine Recovery Council.
Oh, Betsy Fitzgerald, litigating subdivisions.
Maggie McLaughlin, Director of Health and Human Services for the City of Portland, representing litigating subdivisions.
So before we get started with the rest of the meeting, Chastity does have an announcement for the group.
Very sad to report that as of this morning, Daryl has resigned from the council. He has taken on a new position, is no longer able to serve in this capacity. So the governor's office has been informed and will hopefully get us someone great soon. Gordon.
Thank you, Chastity. Do we have anyone who signed up for public comment?
No.
All right, so we'll go over the agenda for this meeting. We will review the March minutes. I will do the chairperson's report. We'll have Carol Kelly joining us. We'll go through the committee reports. We'll have some reports from staff, new business, and then we will adjourn. Just a couple of notes. Carol from Pivot Point will be joining us at 2:30, so we'll have a pause at that point. HRIA will be with us at 3:00. With Grayson sadly departing us, we will now have our roll calls through our MRC secretary. So thank you, Betsy, for that. And before we go to the March minutes, I'm going to pass it to Elizabeth to do an overview of our Google Drive, Google Calendar access for the council.
Sorry, I'm navigating two screens for the first time during this meeting, so take me a second. Folks on Zoom, you can see this.
Yes.
Okay. So this is, and I will pop the link, but this is the council Google Drive, which you should all have access to. Each committee, and if I'm like going too slow and you are all like, I understand how Google Drive works, just tell me to move faster. But each committee is going to have its own folder. So in each of these master folders, there is a folder for each individual meeting. All of the meeting materials for each meeting are going to be uploaded here. So you will have access to these. You don't have access to edit or upload materials. You just have access to view. And then I think I just need to stop sharing to pull up the other window.
And the public also has access.
Yes. And then,
This is great work, Elizabeth.
thank you. And I can upload some more of the background documents as well, because those things aren't in there. So things like the travel form and things like that. And I think I just shared that on the screen. So the travel form and any like other background documents, I can make sure that those go in there. So I'm just trying to make sure I get to the there. So just 1 second, I have to pull up the link for the calendar. So once with the link that you all should have to the calendar, once you open that link, and I'll make sure you all have it again. Yes. You should. Don't know what not without showing the wrong. And okay, so it will pop up when you open that link, and it will ask you to add the calendar. And then those will populate. Each calendar invitation is going to have the Zoom link, the link to the Google Drive folder, and then all the way at the bottom, each material meeting item is attached here. So I know not all of you use Google Calendar, but I think a number of you do. So this is just hopefully going to put everything in one place so that you don't have to go back through your email for every meeting and find all those materials. So between the Google Drive and this, you should hopefully be able to access things a little quicker, but I will also just make sure you have both of those links. And if you're not able to access anything, let me know, but these will work for the council members and the public to be able to view all of these materials. So again, if anybody has any questions, just let us know.
Elizabeth, I just have a quick question. So for the link on the Google Calendar, is that to join as a panelist? Or does it matter, or will just
I
link?
double check. I think I put the public, but I will double check.
Awesome, thank you. Does anyone else have any other questions?
I don't have a question. I just want to say thank you so much for doing that. I have found it very cumbersome in the past to find stuff, and you have made it incredibly easy. So thank you so much.
Well, I'm glad it's helpful. I was worried that nobody was going to need this. So it's helpful for people.
Oh man, I've used it a ton. So thank you. It's amazing.
Yeah, thank you so much, Elizabeth. This is really convenient. It'll be super helpful. So in your packets, we have the meeting minutes for our full council meeting from March. So if there's any comments, corrections, otherwise, I'm looking for a motion to approve.
So moved.
Moved by Maggie, looking for a second.
A second.
Seconded by Amber.
Amber.
Any discussion? Betsy, can you please call the roll?
I hope so. All right, Amber Pulsifer,
Yes.
and I will say yes. Deb Poulin.
Yes.
Joe Everett,
Yes.
Liz Blackwell Moore,
Yes.
Maggie McLaughlin,
Yes.
Paul Vincel,
Yes.
Jess Parks,
Yes.
Todd Brackett.
Yes.
The motion carries. It's unanimous.
Awesome, thank you so much. So next up is the chairperson's report. We've talked about this before, but Chastity's contract will end on July 1st. This will end during the blackout period, and the state would not be able to process the contract. So to avoid the blackout period and ensure that we can remain fully staffed, have Chastity, we are going to hopefully extend her contract outside of this window, and we will need a motion to extend it. Is there anything else you want to add to that, Chastity?
Yeah, this is basically just a bridge. The executive committee is still gonna meet and review and do all of that. So for right now, asking for a bridge amendment to extend to, did we put 10-1?
October 1st,
Yeah.
2026.
10-1, and then also going forward, it gets the ED contract outside of that awful state timeline of July 1.
And I'll also note that the executive committee will convene on Wednesday, the 29th, April 29th at 11 a.m. We will look at the following. Does the current contract reflect the needs of the council for the ED? Determine a method to recommend if this contract amount should be increased, and then evaluate the current executive director and make a recommendation to review. And I believe Brendan had sent something.
Brendan, should it be two separate motions, one specifically for the amendment and one, the other one about the executive committee, or wrap them all together?
It'd probably be a mouthful to wrap them all together. I mean, but you could do it either way. I guess for the sake of convenience, I'd suggest doing it all together.
What do we need a motion for the executive committee for?
To be able to go into executive session. So the recommendation is the council is directing the executive committee to undertake a review of the executive director contract performance and make recommendations to the council.
And do so under executive session.
Yes,
Right?
I lost it because I'm reading it from a text.
All right, I can try. I would like to make a motion to amend the MRC's executive director's contract to end on 10/1/2026. And for the council to go into executive committee, you got the word.
I'm gonna, mix you up. So this is the first part.
Oh, okay. I got that part. Oh, do I have to read that too?
I think we just have to acknowledge the existing contract, same rate.
Okay. Do you have it?
What I have so far is to amend the executive director's contract to end on 10/1/26.
At the current rate.
Okay,
Okay,
thank you.
and
This is where it gets hard. So
okay,
starting here.
okay. And that the council direct the executive committee to undertake a review of the executive director contract performance and make recommendations to the council regarding any steps to take about the role. This should have been two motions, including, but not limited to, extending the term of the contract and any amendments to the contract regarding compensation or duties. Thank you.
Is that your motion, Deb?
That is my motion.
Looking for a second.
I'll second that.
Okay,
But I'm not
It's in your
stating.
email also.
no, it isn't. All I got was. All right, you know, we'll do that out later.
That was my first motion and that was quite a motion.
Good job, Deb.
Thank you.
You got it.
Okay,
You got a first, a second, any discussion? Okay. Not seeing any. Betsy, will you please call the roll?
Amber Percival,
Yes.
I will say yes. Deb Poulin,
Yes.
Joe Everett,
Yes.
Ms. Moore,
Yes.
Maggie McLaughlin,
Yes.
Paul Vincel,
Yes.
Tess Parks,
Yes.
Todd Brackett.
Yes.
Seeing no one in opposition, you have a unanimous.
Thank you.
So you want
Motion carries. I'm going to turn it back over to Chastity.
First, thank you all. So we're gonna bring on Anna McConnell from Maine Access Points. There are different committees in the council. We've talked a lot over the last few months about hearing from our grantees. So going forward, we're gonna open it up if grantees want to come and talk about their work. We'll put 15 minutes on right before the chair report, so we can start with that. And Anna is hopping over right now and she'll be able to tell you about all the great stuff MAP is doing.
her name again? Anna. See.
Hi, all. Can you hear me okay?
Yes, hi Anna.
Hi, thank you for the opportunity to speak with you all today, and I will be cognizant of the time. Chastity invited me to present briefly about our program and the impact that the Maine Recovery Council funds have had for our syringe service programming and broader services, and I wanted to speak with you about that today. So, Maine Access Points is an organization that I co-founded in 2018, and we now offer statewide harm reduction services. We provide syringe service programming specifically in Calais, Machias, Rumford, Biddeford, and historically Sanford. We're currently in negotiations with the city of Sanford about hopefully restarting syringe service programming in the future. And we have been incredibly grateful for the support of the Maine Recovery Council funding for syringe service programs. I can provide an overview of our services and then I'll speak specifically to the SSP. So, as a comprehensive harm reduction program, we offer the SSP services as well as operating as a Tier 1 overdose education and naloxone distribution provider. So we work with over 30 individuals and organizations across the state in all 16 counties to provide really in-depth education and training around overdose prevention education and increasing people's capacity to do naloxone distribution within their specific individual communities. In addition to that work, we do operate a drug checking program, which I'm looking forward to coming back to the council in June, hopefully to present about our drug checking project, what we're seeing in the community and the impact it's having. We also collaborate with our Office of Behavioral Health to provide peer support services through a contract that really focuses on certified intentional peer support services that are offered in partnership and really insight with our syringe service programming. And that is an incredible opportunity for us to train staff with lived and living experience to be on the front lines, engaging with people in the community. And then last but not least, we are on the front lines of this HIV outbreak, doing HIV testing, hepatitis C testing, and then certainly linking folks to treatment services. And certainly within all of our programming, there's a big focus for us on connecting people to other social services, other medical services, treatment services as appropriate. And what we find as a harm reduction provider is that we're able to kind of be that first point of engagement for people that are actively using to build that trust and then to connect to other services. And I'm sure most of you are kind of familiar with our model and why, why we are so effective at building trust and then helping link people to additional services. So right now, there's a number of challenges that, of course, we're facing in terms of funding, and I wanted to speak with that briefly to kind of paint the picture of where things are at and to inform your decision about possible continued funding for syringe service programs. So the first is that as a syringe service program, we face incredibly high barrier funding restrictions on the supplies that we're able to purchase with the funds that we receive. So you may know that there's a longstanding historical ban on using any federal dollars to purchase syringes, which is a huge challenge that syringe service programs face. We also have the inability to use any state funds for any non-injection related supplies. So one of the things that we found to be really impactful, especially we've seen in the last year, is a big transition of folks instead of using injection related supplies, transitioning to using smoking, snorting, other modalities of drug use to reduce their risk for overdose and to reduce their risk for HIV and hepatitis C. And so we're unable to use any state related funds for any of those supplies. Certainly we, as I'm sure all of the other syringe service programs, work incredibly hard to connect with private foundations, individual donors, other funding opportunities to support our work. But as you, I'm sure, are aware, you know, there's a lot of work we still have left to do around engaging and educating the general public about the value of harm reduction, about the value of the community that we serve. And what we have found in this last year is that the Maine Recovery Council funds have been essential for us to fill that gap, specifically around purchasing supplies. That if we didn't have those supplies, we wouldn't be able to engage with the people that we're engaging. And I think one of the reasons that we can build those trusting relationships is because first and foremost, we have what people need, we have what they're looking for, we're able to meet those needs, and then that is really the foundation of building those relationships. And so many syringe service programs, including us, at this point, are looking for and hoping for your continued support to be able to continue to confidently distribute the supplies that people are needing. I want to briefly speak to the funding that we do receive through our syringe service program contract with the Maine CDC. This current year, they provided 2-year contracts to programs. Year 1 is wrapping up, and we're about to enter into our year 2. The funding that we're receiving from the state is going down pretty significantly. So this year 1, we received $343,408. That's being reduced to $279,441. The loss is $63,967. That may seem like a small loss, and it is very big to us because this is one of the very only funding sources that we have that we can put towards supplies. Specifically, that state funding piece is what we can use to purchase syringes because it doesn't come from that federal dollar source. It comes from that state source. And because of that, we're able to use those to purchase the syringes. So right now we're looking at for next year in terms of that state SSP contract, not considering Maine Recovery Council funds, we're looking at, a total of basically at $140,000 that we can use for harm reduction supplies. That doesn't include us being able to purchase any non-injection alternative supplies. And for context, our annual supply budget this year was $350,000. So that's about $200,000 right there. That without the Recovery Council funds, we don't have a funding source for. So I wanted to share that with you, so that you know kind of where we're at as a grantee and a recipient of your funds, um, so that you can hear from me directly about the value and benefit of what this funding opportunity has meant for us in terms of being able to access the ability to purchase these supplies and get them out in the community. Um, for context, last year in 2025, we were able to distribute over 55,000 safer smoking supplies. That's how large the need is in our community. Um, and that wouldn't have been possible, certainly without the funding and support for this. What we're finding is that, even though overdose fatalities have continued to decrease, there's still some really significant drug-related harms that we're navigating, related to contaminants in the drug supply, and now what we're facing with the HIV outbreak. And so part of our work for the next year is really to keep harm reduction supplies present, access to be incredibly low barrier so that we can maintain the engagement that we've established, and get as many people we can in for HIV testing and linkage to treatment so that we can help, certainly prevent the worsening of this HIV outbreak that we're currently seeing here among people who use drugs in Maine. Um, so I will pause here. I wanted to provide any opportunity for questions about us, who we are, our services. I'll just say two things. One, our whole programming is focused on reaching folks in rural areas. When we started MAP, that was our mission, and we've been happy and grateful to have been able to stay true to that. And so, um, access to harm reduction looks different, where we work than it does in Portland and Bangor. And I just can't tell you like how impactful it is to be able to um, ensure that people have their needs met when there's such limited access to transportation and the ability to reach our more populated areas. And the other thing I'll say is, in light of the HIV outbreak, we as an organization are really working to build up our own internal capacity for our own providers being able to provide treatment on site at our SSPs. And certainly we wouldn't have been able to confidently get to that place without your support. It's provided a level of security, and the ability for us to financially really consider investing in a long-term infrastructural plan to continue expanding and growing, and that has just been so valuable for us. So we're now in a place where we are currently being credentialed to provide clinical services that can receive main care billing and other financial revenue opportunities for our organization. And we wouldn't have gotten to that place organizationally without your support. So I just want to express my gratitude, of course, and just let you, understand just how beneficial this has been for our organization, and how beneficial it would be going forward. So I'll let you open it up and answer questions, and happy to speak on anything that would be helpful.
Thank you so much, Anna. That was great. Do any counselors have questions?
Hi. Hi, Anna. Thank you very much. This is Paul Winslow. You got two pretty large funding sources, the state and the federal government, and both of them have specific restrictions. So the Recovery Council money would be spent on things that you can't spend those other funds on. Can you tell us what specific items might you use MRC money for?
Yeah, absolutely. Thank you for that question. So we will use our state funds, the $140,000, for injection supplies. So injection supplies include syringes, but also other injection related items, including, filters, cookers, cottons, tourniquets, alcohol wipes, everything that comes around safer injection supplies. That 140,000 won't meet the entire needs for the injection supplies. So certainly we would pull from Maine Recovery Council for additional injection related supplies. We would also then use the funds for safer smoking kits, which include the actual pipe that people use to smoke, filters to prevent contaminants from going into the lungs, pipe covers to make sure that folks aren't getting cut lips and then transmitting hepatitis C or other bloodborne infections through sharing of pipes, which is very common in the community. So, kind of all of the safer use supplies related to safer smoking. And then we do offer other modalities of safer use. So, safer snorting supplies include things like straws, alcohol wipes, and various ways to kind of create a clean surface. That's very important. And then, uh, you know, kind of your variety of hygiene related products. So we have, gloves, we have, wipes to clean the surfaces. We have, various like PPE, for folks that are interacting with blood and are around blood related to their drug use. So that would be the bulk. We have used a few $1,000s of MRC funds this year for the ability to provide some basic need supplies at our certain service programs. So like a snack bag and a water. We have, some hygiene related products, which people find to be really helpful, especially folks that are unhoused. That has been a really great opportunity to support those needs. But really, because the need is so high for the purchasing of syringes, pipes, and other safer use supplies, the vast majority of the MRC funds for us would really continue to create the opportunity to offer those. One thing I do want to share with you is that part of what's so challenging for us is with the federal tariffs that went into effect, the price increases for supplies have been very significant. In some cases, we're up 150% on items. There were specific tariffs placed on syringes related to the federal administration's approach to fentanyl. So we are now like having to pay for more expensive for safer use supplies because of the impact that that we are seeing here in terms of drug use being very prevalent in our country. So we're paying more on syringe items, but then other aluminum tariffs have impacted a number of items that we buy and medical supplies as well. So, we're kind of chasing a never-ending challenge right now of things like simultaneously becoming a lot more expensive, as the need is also been continuing to grow. So I'll leave it at that.
Thank you. One more question. The amounts that you stated from the Maine CDC and the federal government, is that for all 5 Maine
Yes.
exercises together?
Yes.
Not for each one separate?
That's for all 5 together. Thank you for that.
Thank you so much, Anna. This was really informative. I did just have a question. It's
Yeah.
really great to hear that you're in negotiations possibly with the city of Sanford. I was wondering if you could talk about what your organization is observing for the impacts that their moratorium on syringe exchange has been having on participants.
Yeah, this is quite hard to talk about. We have seen a very negative result in the community with no access to SSP services. It's a community of high needs and low resources, and the primary folks that are most impacted are people that are experiencing homelessness. We are continuing to support as much as we can with non-syringe service program services, and we remain committed to that. But we are seeing increased infections, increased wounds, cases of endocarditis. And so we're seeing the negative health outcomes that directly result from not having access to SSP services. And hopefully we'll be able to convey the urgency of those things to the city and to work with them to find a solution.
Thanks, Anna.
Mhm.
Anyone else have any questions? Yeah.
I can't wait to hear of your drug testing.
Great.
So Anna, can I just ask, in the conditions we're living in, like is there anything you would add that keeps you up at night? You've been very comprehensive, but it's really, really hard right now.
Yeah. Right now, it's the HIV outbreak that's keeping me up at night. I am very, very, very concerned.
Mhm.
There is not enough access to sterile supplies, and we're seeing new infections rising way too quickly. And I really am encouraging all of our elected officials and government officials to deeply reconsider the restrictive policies that limit syringe service programs. And so that is a big ask and demand that we actually consider providing needs-based access to syringes in this state. We are one of only 3 states in the United States that restrict syringe access, that do not offer needs-based syringe access. Us, Florida, and what is it? Hawaii. So us, Florida, and Hawaii are the 3 that do not offer needs-based syringe access. And we are doing this even when our federal CDC is recommending it.
Mhm.
And to me, in the middle of an HIV outbreak, it's shocking. And so I'm really hopeful that our CDC and our governor's office will really consider responding urgently to the need for syringe access.
For sure. Thank you.
Yeah, thanks.
Thank you so much, Anna. We really appreciate you taking the time. And, you had said during your talk that there is a lot of education that we need to do at the public level to talk about the value of harm reduction. I can assure you, we value you here deeply. We believe in science, harm reduction, evidence-based practices. So thank you so much for the work that you're doing, especially in rural Maine, where, like you said, access and transportation remain pretty big barriers.
Yeah, thank you, Tess, and thank you, everyone. And I look forward to coming back and talking about our drug checking project. And I'm always available. So please, if anyone on the council would like to speak more or have questions about MAP or the work that we do, please don't hesitate to reach out.
Thank you, Anna.
Thank you.
So Carol should be joining us around 2:30. So we have a little bit of time to look at something that was just released by the Moss Center in the last few weeks. Many of you may recall that in the first year of this current legislature, legislation was put in requiring opioid settlement fund transparency for expenditures from the litigating subdivisions. So that bill was passed last year and went into effect this year, where the reporting is required. And the Moss Center created a dashboard to show us what those expenditures are. I want to give a caveat here that the language in LD 110 did not require the reporting of allocations, only expenditures. So we're really looking at money that went out the door. So the dashboards are somewhat misleading, where we're not really getting a full picture of how every group made decisions around that spending. Would we be able to pull it up on the screen?
Yes, I'm just pulling up the 2026 allocation really quickly.
Well, she's doing that test. Do you know when the syringe service program in Rumford started?
I do not, Cassidy.
20. Well, you?
Okay.
21, 22? It's been a few years.
So this is the dashboard that just went live. There's some spending from a bigger picture. And then there are tabs where you can look at the different subdivisions individually. You can look at our spending as a Maine Recovery Council. You can look at Office of the Maine Attorney General. And it's important to note that this is just for the calendar year 2025. And there was some non-mandatory reporting that I believe the vast majority of subdivisions voluntarily participated in, looking at their process for spending. There's information on pillar contribution, so what percent went to prevention, harm reduction, treatment, recovery. Has a lot of really cool information, and I would encourage fellow counselors to take some time looking through this website. I think it can help inform our work, seeing where other allocations are being made. Well, sorry, not allocations, expenditures. Anyone have any questions on the dashboard?
Can you, go to the Recovery Council? Because it say. So in 2025, it says we've spent 14 million.
That's to date, so that would be beyond just 2025, right?
Yeah, that's just payments that went out the door. So that doesn't account for like any year twos, and all of our contracts are starting to roll into year two or still in their year one. So that's significantly lower.
So this says in calendar year 2025, $14,042,906.52 went out the door.
That just seems really low. When we approved the grants in 2024, what was the total amount of that?
So this might be what Chelsea's saying, so I just pulled it up. This is only the payments that went out in 2025, so most of these will have the second payment that hasn't gone out. So there's about 9 million in those contracts that has not been paid out, and that's those year two.
So what was the total that we approved? I thought it was like, I don't remember what it was. In that 2024 grant process.
It was like 13 point, it was like around 13.
Oh, okay, all right.
Yeah, so Paul, the expenditure data won't really capture
Yeah,
every single.
I understand that, but I thought we had spent I was thinking for some reason like 42,000.
And like
42 billion.
Yeah.
And if it was only 14 that went out, I said, something's wrong here.
And like of that
just
13 million that we approved in that, you basically cut that in half, and that would be reflected in that number.
Okay.
Yeah, and I will just say for the public too, and for any counselors, the organization that I work for, Maine Recovery Action Project, we have our own tracking system where we record allocations from meeting minutes, just to try to keep the public informed. I know there were a number of subdivisions that had some really impressive investments in 2025 that are not captured in this data. So if you check out our website, there's a link to our spreadsheet, Who Holds the Power. You'll be able to see just some other spending allocation information.
And someone on this spreadsheet is what we sent to the Moss Center, and this does list every contract that went out in 2025, or every payment that went out in 2025, and it will have a short summary of the project that was funded. But again, that's just 2025. So we had a couple that were supposed to go out, in the end of December, and unfortunately those missed the December. So those have already gone out in calendar year 2026. But so again, this is just 2025. But this here is a list. It's a listing of what all of those projects are. So if you're looking for that in-depth data, that is there.
Great. Any other questions about the dashboard? All right, not seeing any. So we will start our committee reports, and I'll pass it over to Paul to give us an update for governance committee.
Okay. So the governance committee met on March 27th. We spent most of our time on two different things. The first one was the policy, or I think I'm going to change it to procedure for MRC personnel contracts. We worked on that. We're not ready to present anything yet on that to the council, but just to know that we are working on it. And I have to say it's a challenge for me because I don't have any experience with contracting people or HR type of thing. So it's a challenge for me, and I'm relying more on other members of the committee for their expertise. And since we can only talk during the meetings about it, that's a slow process. But we worked on the orientation, and we came up with some good ideas, and I'm presenting this now. Do you want to present that, Elizabeth?
Yeah.
The notes on the discussion. And this is not something where I'm looking that we're presenting this to the MRC for approval yet, but I think it's ready for us to present to the MRC for discussion. In red are things that I put in that we have not discussed in the committee, but they were who I thought might be able to speak on these. And you can go through, there's 10 different subjects going over the history of the crisis, history of the settlements, the MOU, the settlement funds, structure of the MRC, relationship between AGs and MRC, FOA, the pillars, and kind of the history of the grants we have already approved. And I put there who I thought would be a good idea, or who I thought would have the expertise to talk on it. So you can look at that, and I would love to hear conversation on it, or comments or questions.
Awesome. Anyone have any comments or feedback for the orientation?
Just put down a bit.
It's
Paul, thank you again for doing this. I think it's gonna be so transformative for us. So I appreciate that. I also think for the public as well, it'll be really useful. I think probably this is a hunch, throwing it out there, volunteering you or Pat, but probably to lighten the load on Brendan, the pillars of the opioid abatement, I think could be taken by the executive team. But also I'm thinking about what you presented first, Elizabeth, in terms of that drive. Currently, all this information is in there, but in specific meetings. And so it's hard to navigate to the meeting if you don't know. So if we built out this also as an orientation folder for the public and for us, that'll be a great kind of centralized resource place.
Really good idea.
I was, as I was kind of thinking of this, I was really excited about the discussion we had in the committee about subject number 1. And I was thinking of how I would want to present that from a medical standpoint, and was really excited to hear I'm excited to hear how Tess or other people with lived experience would present the history compared to how I would have presented. I think it would be really interesting.
Paul, I've had the pleasure of watching you give the science of addiction to members of the general public, and you really do an amazing job. And I think it could be really helpful to talk about the brain science in a way that is understandable and taking away the narrative that somehow addiction is a moral character or an issue of not having enough willpower. I think that would be really, really powerful.
Thank you. I will include that. And I think that number 11 is really important if it's under there. This orientation would actually, if we just did it in one setting, would be pretty long. So it might be better if we spaced it out and did 30 minutes here and 30 minutes there. And then we could probably get it done in a few meetings.
Brendan, do you have your hand up?
Thanks. Yeah. And for those who are seeing my name all over the document and are kind of wondering about that, I just want to assure you all that I was volunteered for that. And I'm not opposed to that, to having been volunteered for those topics. But I certainly encourage, anyone who feels like there's somebody else who can or should or, would do a better job on a particular topic, certainly feel free. I'm happy to help out in any way the council needs with the orientation. But, if folks want someone else to present on a particular topic, I'm more than happy to accede to that.
I volunteer Brendan to not do the 4 pillars.
Okay, we'll put the executive team on.
Yeah, I think that can be split up because the council's made up of so many different experts that it can be a team effort.
Okay.
Yeah, rest assured, Brendan, we will make this a team effort, the orientation.
Okay, that's pretty much all I have to input. So for our next agenda, I will put that together, Elizabeth, and get it to you hopefully tonight or tomorrow. But we'll have further discussion on the procedure for evaluating personnel contracts and for orientation. And then there was something else. Oh, we want to put in, who is it that wants to speak?
Carol Kelly.
Carol Kelly. All right, good.
Carol Kelly was asked to join all of the committee meetings this month, so she'll be added to each. And she'll also be here any minute. So next committee, we would pause you.
All right, Paul, is there anything else that you want to add?
I don't think so.
And your next meeting is Friday, the 24th at 11?
Okay.
I think so. That's what I have here in my notes.
I think that's about
And now we have the
Yeah.
Google Calendar that we can all look at.
Yeah.
Great. Any questions for Paul? Hey Jamar, I just noticed that you're online. Do you want to introduce yourself?
Yes, thank you. Good afternoon. Sorry for being late. Jamar Williams, represent Prison Reentry. Glad to be joining.
Thank you, Jamar. And do we have
Thanks.
Carol here? Next, we'll jump over to finance. I'm going to pass it to Deb.
All right, we had a lively meeting. It was really good. We missed Sheriff Brackett because I think we covered everything that was important to you and you weren't there. But that's okay. I'll try to do a recap. Daryl took some great notes. We discussed the monthly fluctuations in administrative expenses and just that we need to continue to watch that, but there's not a lot that we can do to control that. We just need to be aware of it and plan for it. We talked a bit about ongoing funding commitments and one-time short-term funding allocations, and those are projects that are really being shared between the Finance Committee and the Program and Grants Committee. So we're looking at developing processes related to determining how much we want to allocate to ongoing funding commitments versus our one-time funding. That has to do with our overall grant planning, which leads me to another piece of my update. Let me know when Carol gets here because I can stop. There's a lot of information. One of the areas that everybody was very interested in that we looked at is I went back to, and I misspoke in the last meeting, I went back to the former treasurer's spreadsheet, and he actually did have projections related to how much spending the MRC would do annually versus how much money would be coming in. When he did his projections and his longer term budgeting, he also wasn't necessarily aware of the smaller settlement dollars that would be coming in that Brendan reminded us of. So the smaller settlement dollars cumulatively will probably be somewhere between 20 and 30 million. So that's actually a good ongoing influx of dollars. So where we started to see budgetary red in the out years, we'll be able to offset that a bit by those incoming dollars. So that's a good thing. And that will also increase the lifetime and the amount of money that we'll have to support the different existing projects and new projects. With that being said, one of the questions that I have for the MRC is one of the areas that the Finance Committee has been working on over the past couple of months is an operating budget. And we really need to approve that budget as a full council. So I need to bring that budget to the council because it basically codifies how much money we want to allocate in any given year. And in order to know what we have to allocate, we have to operate within our means. And so I presented the budget, I think 2 meetings ago and said that I was working on it as a draft, but we really need to, I see a lot of puzzle faces. We really need to vote on that and have some input. So I think at the next meeting, I would like to be on the agenda so that we can do that. In the former treasurer's spreadsheet, it said approved budget by the council, but Pat, who is not here, doesn't think that it ever actually got presented and approved. It was just sort of talked about and then it moved on. I'd like a vote. I think that we need to be transparent. The other area that I'd like a vote on is I had advanced a suggested operating calendar that accounts for the blackout months. That operating calendar also includes emergency funding and off-cycle requests. So there's an opportunity to balance that. That also should be a full council vote. So I would like to have that on the agenda at the next meeting because I believe at this point Program and Grants has looked at it and they think it's a good idea. The Finance Committee has looked at it. They think it's a good idea, but the full council needs to vote on that. I see Carol's here, so I'm going to pause because there's more.
Thank you, Deb. Hey, Carol.
Hey, everyone.
Now, before I pass it over to you, I'm just gonna have Chastity give a little bit of an introduction and set the table.
So I'm sure most people in this room already know Carol in some way or have seen Carol. Carol has come on to help us with some strategic planning. We had hoped to start this sooner, but for all the reasons, it's got pushed out, but she's here, she's ready, and she's gonna be telling you a little bit of what she'll be doing with us to actually set the table. And then you'll be seeing and hearing a lot more of her over the next couple months.
All right, take it away, Carol.
Thank you, Tess. Thank you, Chastity. Carol Kelly, she, her pronouns. Great to see all of you. Some of you from a great distance here in the Zoom room, but I know you're there and I can hear your voices. I actually would love to hear the rest of Deb's presentation too. Maybe I can stay on after I'm done and just listen to that because I think it knits right into what we're going to be talking about. So as Chastity said, I'm going to be helping and really honored to do so, be helping with your strategic planning process, which I think we agreed in the early stages the last time I joined you all would be a bit of a broader scope around governance and operations systems, hence my interest in Deb's recommendations. So I think we did, as Chastity said, we're getting a bit of a later start, I think, than we imagined or hoped. But we're gonna keep the general flow, what we imagined, which is starting with interviews, one-on-one interviews with all of you folks who are current members. We also want to, and by we, I mean I, talk to the folks who are past council members. This is really just a chance to sort of get a handle on, the lay of the land, the assets and the opportunities, as well as some of the challenges, and maybe figure out what the patterns are and if there's ways to break through in our systems and structures, but also in terms of our planning work. So the next, I'm going to say, month is really going to be about one-on-one conversations, and I would also like to, if possible and available, join the committee meetings so that I can get a handle on what you all are working on in the smaller groups, and maybe dig in a bit to some of the ways that the parts do and don't fit together well, and we can figure out if our systems are where we need them, and if those breakout groups, those committees, are really the right format. Do we need more? Do we need fewer? What are the scopes correct? That type of thing. So I would love to hear today, if possible, in addition to just general questions, and I know I'm talking fast, but you've heard this before at least one other time, but or those of you that were here at the time. But I would love to hear questions about just the general, what are we trying to do and how are we going to do it? And then also, when you think about if we had capacity, let's say I do have capacity to talk to 5 more people who aren't either current or past council members, who would those people be? What's the short list of additional key informants that we would want to engage in talking about getting ourselves ready for getting together on strategic planning? And I will just say that after this period of inquiry is done, then we will actually come together as a group and do strategic planning conversations in the plenary or the full group context. So I hope I covered it efficiently without too much duplication, but also not leaving a lot of gaps in what we're about to embark upon. So I'll stop there and turn it back to you to manage the conversation.
Thank you so much, Carol. Does anyone have any questions or any feedback for Carol's question or other folks that she should include to interview? Maggie?
Shooting myself in the foot here, but I don't remember the wonderful woman who did the assessment of the grantee feedback. I feel like
Sarah.
Yeah, Sarah would probably be a great key informant interview because she had spent all that time gathering data. and reflecting on what we should do with it, passing that info to us.
That sounds like a great idea. Could one of you repeat the name because it was kind of garbled?
Sarah Yasner.
Thank you. Great. Other ideas?
Carol, could you talk to a current grantee?
Yes, absolutely. I mean, I could, whatever your recommendation is, I would be very happy to do it.
Todd?
I assume on the list of our previous executive director and staff members that.
No, Sheriff, I appreciate that because I have the list of the previous council members, but not previous staff members if we had any.
Yeah, it's just Mary, and I can connect you to her.
Oh, great. Okay. Thank you.
Maggie, you hand up?
I think in terms of grantees, it might be helpful to talk to two levels of grantee in terms of organizational size, because I think that may affect their experiences as well pretty significantly.
It's a good idea. So having almost maybe a different tiered levels, larger, maybe medium, small.
Great. That sounds really smart. Are there other entities that you all have found yourselves, I don't want to use the word bumping up against, but I'm trying to think of a different way to say it, but where you cross paths often in your work? Are there areas where what you all are trying to do seems to almost overlap with what some other groups are trying to do that might benefit from some clarity, or at least their perceptions of their roles in the ecosystem?
What about the Attorney General?
Yeah,
Carol,
I definitely.
we work pretty closely with the Attorney General's office. Yeah, and they also have some money from the settlements for distribution.
Great. I'll definitely make sure that current staff and the Attorney General's team are on the list.
Yeah.
Thank you for that.
Okay.
We're really fortunate to have Deb here from OBH, but the other kind of technical institutions, I'd say definitely Maine CDC. I think sometimes the question of some of the bigger picture for education when we get into the prevention landscape comes up, who's funding what in the long term, what's the vision? But I think Liz might be able to speak better to some of whether that's already kind of documented in the work group for prevention or at the education funds.
Feedback? Carol, I don't want to add too much work, but I think someone that could be helpful would be talking to any of the folks at the Moss that have a pretty bird's eye view of spending, and they've just done a lot of information gathering from the subdivisions. I think it could be helpful.
Great. Thanks, Tess.
Any other questions or feedback for Carol?
I think I saw Liz come off mute, but no? Okay.
Well, I mean, I'm just trying to think through, for strategic planning, on our council versus strategic planning assessment of the money, or what to do with it. I guess I'm, our assessment of the problems. So assessment of the problems and what we should spend money on, that feels like, of course, we should talk to a lot of people. If it's strategic planning with what we do, of course, if we can find out from, I feel like the Moss Center has a pretty good handle on where money is. Perhaps there's a way in which looking at the strategic plan that the state has, that Gordon put together which I know you were actually a part of. So looking at that to see where are we aligned, but that feels more like what we do with the money versus how we operate as a council. And so maybe I'm just sitting here trying to think through how are those two things different. and what work you need to do out there versus like really what the work is with us about how the council is going to operate. So that's what's happening in my mind right now.
It's a really good point, though, Liz, which is it makes sense that as you all evolve in your growth and just natural, progress in how you do your work, you're going to potentially think that your scope covers certain things that maybe other groups or entities, whether that's government or NGOs or other entities, might think they also cover. Like where are all those fuzzy places where maybe there's different perceptions of who does what? I think that's a really key piece of information, not only for where do you potentially invest or place resources, but how you even do your work when you're in those fuzzy areas. I've introduced a fuzzy metaphor, but I really like how you were thinking about it so that we can, it's not just about how you make your funding decisions. It's how you operate in those spaces where it may not be crystal clear. Yeah, thank you for that.
Yeah, I was also thinking too, by bringing up the mass, that it's not necessarily just where the money's going, it's the who, the how, what are their processes for engaging the public? Do they have certain policies? There are things that we might be able to learn from other communities, and it's not necessarily a guarantee, but I feel like there are many times where we're trying to brainstorm processes, and maybe if there's a way to not reinvent the wheel, we can be learning from some other subdivisions.
That's great. All right, this is excellent. This is not your only chance to weigh in on this with deep thoughts and suggestions. So I really appreciate the chance to at least initiate the brainstorm. And then I'll just say that I'm hoping it won't be too much of a imposition to join in on the committee meetings, but I can work with the chairs of those committees to just make sure. But if each of you could just be sort of on the lookout for an email from me asking for 20 minutes of your time sometime in the weeks to come, that would be awesome.
Carol, I confirmed with all of them this morning, so you are good on each of those agendas for this month.
That's fantastic.
With the exception of finance, you weren't on that agenda, so you'll be new business.
New business, I like that. All right. Well, good. Thank you for the time, everyone, and thank you for your upcoming commitment of time and energy to see what we can come up with here. I'm really looking forward to it.
So, Carol, this is Joe, just in case you jump off.
Hey, Joe.
We'd love to have you at the Program and Grants Committee because we're talking about the way we do community needs assessment and data collection and data analysis. And the group at the last meeting talked about using the framework we use with the prevention work group and the school work group, and how Liz and Melissa and Maggie and others convened really stakeholders across the state. So when you said key informant, that really resonated with me because I think that's what we're looking for. So we welcome you, and we'll make sure you know the day of the next meeting because the conversation will continue.
Perfect.
But I just say that in case you jump off. But we look forward to seeing you.
Well, thanks, Joe. Yeah,
Always.
I'm looking forward to it.
Thank you so much, Carol. I appreciate you taking the time.
Yeah, thank you, Tess. Is it okay if I stay on and hear the rest of what Deb was sharing?
Absolutely, please do.
All right, thanks.
And I will turn it back over to Deb.
Okay, so now that I don't feel the pressure of time, I will be a little bit more articulate in what I was saying. I'll start with the budget. There is a proposed budget that I would like to bring to the MRC for their feedback and to vote. I will also say that when I revisited the former treasurer's projected budget for this year, my budget was nearly identical to his projected budget. What that indicated to me, and I did that before I looked at his work. So what that indicates to me is that the MRC is right where it intended to be, where it needs to be, and where it had planned to be in terms of spending and balance. So that was actually a good thing. And it ended up being a good litmus for me and the work that I was doing in terms of putting together a recommended budget. Within that budget, we will need to allocate a certain amount of money that we are saying through our RFP process, this is what we will obligate to the community in this particular year toward contracts. The subset of that allocation is the committee will also need to determine how much they want to commit of that total pool that they're willing to put out to the community. How much of that pool is going to be dedicated to ongoing funding? So projects that we've already funded that are coming back that need additional funding to continue for sustainability versus those one-time infusions of dollars to get projects started, but then they have sustainability. So just identifying, yep, we want to send $9 million out the door. That was an arbitrary number for the public. We want to send 9 million out the door. How much of that 9 million goes to which part? So it's not as straightforward as we would love for it to be, but the good news is we're right where we thought we were going to be. That's good. Secondary to that has been a sub-project, which I just touched on prior to Carol joining us, around emergency funding versus off-cycle funding. The council has realized and determined through communications with our community partners that there are times when there are certain really important programs or initiatives or otherwise that are on the brink of running out of funding and they don't know if they can continue or sustain. And they would like to be able to come to the MRC for emergency funding. So there are two pieces to, maybe three, there are two pieces to that right now. One is we need to define what we would consider emergency funding, what the funding threshold would be for emergency funding, and we need a process to get it out the door. So emergency funding also needs to be considered in the budget, which it is. And then there's off-cycle funding. Off-cycle funding would be requests for projects that didn't go into the RFP process. So it's everything outside of that cycle. Those two pieces are accounted for in that operational calendar that I had shared with you if it wasn't the last meeting, the meeting before. And as I said, Joe's program and grants committee saw the calendar. They liked it. The finance committee likes it. We just need to vote on it and implement it. Key considerations: defining in clear and concise terms what constitutes an emergency versus off-cycle. The second piece, and a really important piece, is we are a staff of 2 right now, and everybody else is volunteering. When we add emergency funding and off-cycle funding to our already chaotic RFP process and contracting, we're it for the most part, aside from our contract vendor, which is helpful. We've talked about getting a fiduciary agent to be able to give money to so that they can get money out the door faster than the council is ever going to be able to through the contracting process and otherwise. So that's another piece that needs to come to the larger committee. I could do it as a package at the next meeting because we'll need a vote on that if we decide we want to do that. If we think we're going to handle RFPs and contracting and emergency funding and off-cycle funding all with what we have right now, we'll be in a constant cycle of contracting and spending and contracting and spending and vetting proposals and determining and voting, and that's actually not realistic. So what we want to do is really important, but as important is how we accomplish it. So those are those pieces. And I think those are the biggies. So we've actually been doing a lot of really good work in the finance committee, getting things organized, and also determining what falls within our authority as a committee versus what needs to come back to the larger group. But certainly a budget has to come back to the larger group. Determining about whether or not we want a fiduciary agent must come to the larger group because that's about spending more money. So that's where we are. Any questions, comments, or concerns?
I guess I just have a comment. Being probably the least financially able person sitting in the room, thank you. because that all made sense to me.
Oh, good.
I got most of it down, but I mean, it made sense. And I just thank you
I'll
for doing
challenge
it.
you on that meeting.
Oh, I don't know.
Actually,
Okay. Well, and I'm not a I'm not an I said that, I'm not an accountant, but I'm happy to do this work, and maybe it makes sense because I'm a non-finance person too, so I have to put it in terms that I understand. And I think we're in a really good place. I do. I think we're in a really good place, which is reassuring. The council's done some great work.
Like, Todd, you have your hand up?
Yeah, I wasn't able to make the last finance committee meeting. I apologize for that. I just want to make sure that I'm not missing anything. In that, in the budget proposal and in the processes that you've referred to, is there still room? Was there still open discussion around small one-time funding requests?
100% yes.
And that will fit in the budget somehow?
I have it in the draft budget that I put together. I have allocated dollars to it. What I
Perfect.
need, what I need from the larger committee is whether or not you agree with the amount of money I put in there. So when I did the draft budget, I did a lot of, this makes sense from past spending and projected future spending, and it seems reasonable, but that was completely coming from my brain and my world and the spreadsheets that I had available to me. I want to make sure that my thinking comports with the thinking of the larger council. When I took my draft budget and compared it to what Ben, the former treasurer, had projected out, it matched up within a matter of a couple $1,000s. So not even a couple $100,000, like a couple $1,000s. So I think the numbers are probably pretty good, but certainly open to negotiation on that with the larger council.
Perfect. Thank you.
Yeah, thank you.
Yeah, I just want to say huge thanks and apologies. I also not a member of finance committee, but didn't get to dial in. And then I had a family event during program and grants. But I think if we can have the discussion in the next program and grants meeting, and then it comes to council, because then it would hit both and reduce the amount of time at council level for discussion. I would flag to, because this was a conversation at program and grants, then I had suggested some scope of work language, which would allow us to send out to a vendor. In that, the thinking was, in reality, off cycle is going to be roughly the same as emergency, likely in terms of how much we can handle in pushing things out. So maybe we condense that category and put in kind of thresholds for thinking about it. But ultimately, it's perfectly dovetailing. A lot of that has to be governed by what's our limit. And it's kind of on a first come, first served basis was the fairest way I could think of it at that time. So in program and grants, we could talk through maybe that particular template isn't the right one, but it tried to combine the small grants with the off-cycle / emergency and the need to get it to a third-party vendor to be able to distribute.
Yeah, and Joe was actually at the finance committee representing program and grants. So Joe, I think you'll be able to take back some of the conversation as well, but it all aligns. Yeah, I mean, one of the biggest challenges we have, not that we can't do off-cycle and emergency, and I think we should, I'm just not, it's the we. Who is the we? Is it that, I don't think it can be the council, because you're right, it's that constant churning of proposals and vetting and contracting and allocating. So that's not a fast process, and we just don't have the resources available in as rapid and organized a way as we would like to without a third-party agent.
Yeah, I think, Deb, thank you for your leadership on this. I feel like in a lot of different committees, we're starting to bring together pieces of where we are, where we want to go. And that's something that maybe we hadn't been doing for a while. And we're working together, there's becoming more clarity. And at the end of the day, our capacity is really limited. So I think what Carol could maybe help us do is, this is our vision.
Yes.
These are the things that we want to do. should we phase it in? Maybe we don't tackle every single one of these portions in the next year, because realistically, we can't. We just wouldn't be able to do that. And then also figuring out our budget for the next year, aligning that realistically to what we can roll out. That does it, because I've seen the calendar that you suggested. I really like it a lot. Maybe we can't do all of that this year. So I think I'm so happy that Carol is a part of this meeting in particular, because I think, her work with strategy planning, we can maybe come up with a shorter term, a longer term plan, and figure out what capacity we would actually need for staffing to be able to get there.
Yeah, I think that that's right on. And it's good that Carol's going to be attending the committee meetings so that she can hear the conversations and see the work. And it might even be worth it in the finance committee with Carol being there to just sort of do a very quick overview of what we what we looked at the last committee meeting, just to orient you right there. Instead of a her, you're right there. Yeah, so I think that all makes sense. I also think, and then I'll stop talking, that a lot of that getting organized around the finances and the calendar and the otherwise is going to be important for the communities, so that the communities know what's available and when it's available. Because that's the most important part, is getting our funds to them.
Any other questions, comments? Not seeing any. And the next finance meeting, the 17th at 11 a.m.
That's right. That's this coming Friday. Not tomorrow, not this Friday.
Next
The
Friday.
next, yeah.
Awesome.
I keep feeling like it's Friday.
I didn't even want to guess what it was. All right, so I'm going to turn it over to Chastity to bring us to our next agenda item, where we'll be hearing a proposal from HRIA.
Sorry, Joe, we'll get back to program and grants shortly.
Nope, I think where Deb and I are really in alignment. She did a great job, so I won't need much time. So good job,
Awesome.
Deb.
Thank you. So in your packets and in all the places you can find information now, there is a proposal from Health Resources in Action. In this work that we've brought them on to look at how we do grant making for the upcoming prevention stuff, in all these conversations, I asked them, can you just put something together to tell us what it would cost if we just give it to you? The council can still make the decision, but to do the whole application process, have a platform to do it, and we can bring that back. Because, I mean, we say capacity 1,000 times, and this is capacity and be super helpful. So I'm gonna let Ben and Heidi, who you've heard from at least in program and grants before, do an overview of what this proposal is. And doing so now, just to be very realistic on the timing with the upcoming blackout dates, we need to have our contracting for anything this fiscal year turned into finance by April 24th, and anything for the start of the next fiscal year by May 15th. So that's why this is coming right now. So with that, Ben, Heidi, you want to take over?
Sure. Hi, everybody. I'll jump in real quick. So Ben Wood, Health Resources in Action. It's nice to see everybody. We have been to the full council meetings before. Here with my colleague Heidi Klein, who I don't think has been at the full MRC meeting, but has been to the program and grant meetings. And Heidi is a managing director in HRI's grant making cluster division department. Knowledgeable about how to actually implement and set up the actual infrastructure of grant making activities, which is what we're going to briefly talk about with all of you. I just want to say that we're making great progress on the community conditions RFP process, and having had really good conversations with the program grants subcommittee and with other members of the MRC. So we feel really good on the content side, and I think that this is just an opportunity to support the MRC in an additional way, as Chastity is describing, to create additional capacity with existing infrastructure that HRIA uses for multiple different types of grant making activities. And so we have the proposal in your packet, and it builds on the work that we are already funded to do. And Heidi can explain, of course, all of the particulars, and answer any questions that you all might have.
Great. Thanks, Ben. And as Ben said, and I'm very grateful, Chastity, for you sharing the information ahead of time. My name's Heidi Klein, with Health Resources in Action, and I am Managing Director for Grant Making. Before I came to HRIA, I spent 10 years in state government in Vermont, so I've been able to see grant making from both sides, and I'm very familiar with what it means to have a combination of federal, state, private funds and needing to follow public processes. So as Ben said, what we've put together here is a proposal that builds on the work we already did in sort of designing a grant making opportunity for the community conditions. And what I've added to it is what we would do for implementation. So it allows us to have continuity from design through the full implementation. And what that means is really covering all the ins and outs from application through the review and through the selection process. HRIA has a grant management system that's called Smart Simple. We did a out for bid and selected this a couple of years ago, and it's now up and running. The point was to make it super simple for both grant applicants as well as reviewers to access an online system. It also makes it really easy for us to manage whatever data is within that system. So that is both the applications that would come from the community as well as the reviewer responses. And by having all that information in this one portal, we are then able to take out information that provides a really good idea of who's coming in, what are we seeing in terms of trends. So not only are we able to look at one application cycle, but provide to our clients a retrospective of here's what happened, and work with them on thinking about the next round of where they might want to improve their processes for the next round. So this application, the proposal that we put together includes the cost that we have both for using the system as well as for staffing the system, as it were. So that includes the application support. There's a whole bunch that goes into ensuring that whatever materials we develop in collaboration with your grants group gets translated into the portal. We then provide support to applicants by doing a webinar on here's what the opportunity is, here's how you use the portal. We provide office hours, just a lot of support to applicants so they know how to get into the system so that they have as easy a time as possible in putting in their applications. We also provide reviewer support. So we provide an orientation both on the content as well as sort of what is this? What are the proposals we're using? What are the criteria we're going to use to determine whether a proposal is strong and solid and meets the intentions of the MRC as we think about funding it? And then we also work with reviewers too, as very importantly, which I think you'll all understand, is we provide support in assigning the grant reviewers to applications in ways that avoid conflict of interest, which I know is always a challenge. It's especially a challenge in a small rural state and with a small pool of reviewers, but that's a piece of support we provide. Then we also work with clients to screen the applications to make sure that they, anything that comes in, the folks are eligible based on the criteria that we've developed in the call for applications. based on what the reviewers do in terms of their scoring. We compile those scores. We provide an analysis of the applicant pool, a summary of the reviewer scores and comments, and bring that back to all of the reviewers. And we would bring it back to the MRC overall to say, here's what it's looking like in terms of a pure scoring review. However, we don't ever recommend stopping there. As you all probably know, different people score in different ways. Some people are high scorers, some people are hard scorers, and sometimes people interpret the criteria differently from one another. So they may be looking at an application and bringing in a different interpretation of what the criteria is using, and or they are bringing personal knowledge or personal bias into the review and their scoring. So we always recommend hosting discussions amongst reviewers to make the final determination of the score and the recommendation as to whether or not something moves forward for funding. And so what you will see here in the proposal is I also offered, we could stop at any point in time, but we highly recommend that there be facilitated convenings of the reviewers to discuss and finalize the recommendations. And that's a space that we do a lot of work with. That's where I think we actually shine in supporting our clients in being able to navigate through some complex decision making. So that's a very quick run through. I did it fast because I know we only have a short amount of time together. And I know that you had an opportunity to see many of the materials in advance. I just want to pause for a sec and check in with Ben and or Liz, who have been part of the discussion of the RFP and are thinking about the review process. Is there anything that I might have skipped over a little bit too fast that you want to make sure that everybody else is aware of? Okay, so I am happy to answer any and all questions. As I said, I know I did that really, really fast. I can tell you about how we do things in general, who we are, and or about our specific proposal.
I have a question. Heidi, thank you very much for that. And Brendan, this question would involve you also. When the reviewers meet to discuss the scores, Brendan, would that fall under the FOA guidelines, and would that have to be public meeting?
Heidi and Ben, do you want to describe the proposal on that part before I respond?
Yeah, I would be happy to. And I can also share some screens if it turns out that that would be useful. We talked a lot about the concern that you're raising now and did some design in this under the first phase of work that you've already contracted for to think about what the review process would look like in a way that enables open and honest deliberation, but also respects grant applicants, prevents reputational harm, ensures that we have a really wide application pool. We keep transparency, we minimize bias, and we make sure that the MRC remains in control of all decision making. So those were sort of the factors that we were looking at. What we recommend in general when we design a process for whether it's in public or not is that we always have multiple reviewers of the same application. Our recommendation is you have some MRC members and some non-MRC members, people who are actually more familiar with the kinds of coalitions, projects, et cetera, that you're looking to fund, because they're going to bring some more personalized expertise to be able to best review the applications. There is a way for us to assign a cohort or a team of folks who are looking at applications, get scores directly, have conversations that include just the people who are doing the scoring of the same applications. So you wouldn't end up having two MRC members. You'd have an MRC member with a community member or whoever else is part of that review team in dialogue. They would then have their final recommendation that would be presented to the MRC for an up or down. So the conversational pieces would happen not in an MRC meeting, but in these individual review consultations. Everything that we would do in terms of recording, we have all the conversation decision points will be in what I called our Smart Simple, our grant making system, which we can pull and access at any time if it's requested. We will also have results of all the conversations in a report back to you in a way that could be accessed by the public, and it would be of public record. But what it does is it's a way for us to make sure we have continuity of conversation, again, that allows that right balance between transparency, availability to the public, and also right sizing the amount of public display of conversation around a particular application. Brendan, did I cover that in a way that you think suits the answer?
Yes. And I think there was, there's Paul, I think we may have talked about this at various council meetings, and Deb probably can weigh in on this better than I can. But it's my understanding that when, for example, DHHS makes, grants or awards RFPs or reviews RFPs, I should say, it follows a similar structure in the sense that there are individual reviewers who then, come up with a score, and then they gather and meet and discuss their scoring, and then there's a consensus score, and notes are created as part of that meeting. So and again, Deb, feel free to tell me I'm completely mistaken about that, but that's my understanding of how the state currently handles the RFP process. The piece about the consensus score, by the way, that process is not subject to FOA's public meeting requirement, the way the council's process is. And so to try to port that in, especially the consensus part, the meeting and the discussion, into the council's structure is not straightforward. And I appreciate, Ben and Heidi's effort to find a solution there. My office is considering the solution. There's a tension within the Freedom of Access Act that we're investigating. And we understand, or I understand, that there's a timeliness about this, so we're trying to resolve that as quickly as possible.
Can I just add, just for one piece of clarification, in case it's helpful, that those ultimate decisions that you're needing to make, Brendan, the use of HRA's Smart Simple platform for grant making, we can adapt to implement in the way in which Heidi is describing. We can adapt to implement it ultimately in the ways in which your office is going to require the MRC to comply with the with public access to information. So just want to make sure that everyone is clear that we can sort of not divorce, but like we can segregate the conversations that we're having around the Smart Simple platform from the review process itself, and ultimately the review process itself can be adapted. It can be adapted to meet whatever the requirements are.
Yeah, thank you, Ben. We have proposed one way that we think would work, and we've priced out sort of the staffing for it, given that way. But we certainly have the ability to be more, to be flexible around the support for reviewers and the actual design of the review process.
And Paul, was my answer too vague for you?
No, I thank you. I appreciate that you're considering that requirement and our needs to meet that.
Are there other questions or concerns?
Liz?
I don't have any concerns with this proposal. I think my only thing I want to put out to the rest of the council is that I think we had been hoping we would mirror the process that was created here and the RFP process and some of the things that come out of it for our 2Gen programming. So if we don't host the 2Gen, like if they host it, there's a part of me that's like, can you do the 2Gen too? I'm worried about us not the 2 generation, we have another pot of money we were hoping to give out and mirror. And if you all do it, how will we do that one? I guess I'm asking that to the council. And so the answer could be like, oh, maybe we can, and we should add this. And I don't know if you all even want to do that for us, but not do the whole thing, but even just like hosting it for us on your platform. Anyway, I guess I'm just throwing that out there.
Yeah, let me just offer one other possible way of approaching it too, Liz. You can use your portal if you're committed to your portal, and we can still help you with all the materials that would need to go into your portal and supporting applicants and reviewers. The portal is just a machine with a data source and some people who know how to program it, right? And so we could replicate all the other levels of support and just take out the first piece if you wanted to. Like just that's another way to think about it. Because the portal is the technology. And what's most important and what we heard too from the evaluation of the last application process was that some people had trouble with your portal and some people had trouble because of the materials that are in the portal. So just thinking about it as two separate things, right?
Maggie, your hand up. Liz, I don't wanna move on to the next thing. Do you feel like your question has been answered? Do you want us to discuss it anymore?
I mean, I'm just raising it as a thing that we might need to figure out.
So Liz, I like where you're going. I think that the way there's so many reviewers and the inconsistencies, I hope that we can pick this up and talk about it. And per our conversation at the Program and Grants Committee, we're down, this council is down the wire. We have 6 to 7 meetings of the council and the committees. So I think it's for the betterment of the work, making it as consistent as possible. Like what HRA is bringing here, hearing from our friends is incredible. And we would like that level of rigor, I think, for every award made and all the processes. I just don't know. Can we pull that off in 6 meetings?
Yeah, I don't want to slow down this one. Like, let's keep this going forward. If other people want to talk about this, let's talk about it. And I think it would be amazing to have you all do this. Like the work has been so great so far. So I would be excited about it.
A good point, Liz, and it would bring some efficiency to it as well, having some processes that are streamlined. Do we have any other questions for Heidi, Ben? Seeing any? So it looks like in our packets that we all have, you go to the HIRA grant making proposal portion. It looks like there's a few options that the council could consider. One being approving the base cost proposal that would forego some of the additional facilitation expenses. And then another option could be approving it all together. So we would get, the base cost and then those facilitation expenses. So if we could have a motion on either of those, or if there's any other discussion.
That we do base cost plus the additional. proposal.
Motion from Maggie to do the base and the additional expenses.
Second.
And that would be for a total of 19,550. All right, we have a first and a second. Any other discussion on the motion? All right, Betsy, can you please call the roll?
Amber Pulsifer,
Yes.
I will vote yes. Deb Poulin,
Yes.
Tamara Williams,
Yes.
Joe Everett,
Yes.
Liz Blackwell Moore,
Yes.
Maggie McLaughlin,
Yes.
Paul Vinsel,
Yes.
Tess Parks,
Yes.
and Todd Brackett.
Yes.
Thank you very much. That would be 10 with no opposing votes. I think the word.
Thank you.
All right, thank you all. And we will work on getting this set up with them and getting the amendment set up to add these additional funds to the existing contract.
We are very excited to do this next stage of work with you. Thank you very much.
Thank you all.
Okay.
Thank you,
And
everybody. Have a good day.
we'll sign off. Bye-bye.
Thank you.
All right, so we'll pivot back to the committee reports, and I'm going to pass it over to Joe for an update for program and grants.
Okay, great. I'm gonna just pick up where Deb left off to try to be efficient. So we had a robust conversation at the Program Grants Committee about the off-cycle grant and the urgent grants, and Maggie had put together a really great framework. And we reviewed it to the best of our ability. The council will pick it back up next month, but it's very good. It's very robust. So it's a proposal for an RFP process, and Maggie, feel free to help me out, to sort of look at hiring an external entity to help with this type of grant making. We had all the information that Deb had prepared from the finance committee that she's proposing we vote on next month. So we like where we're going. We'll bring that back to the council. So hopefully, as Deb said, it'll all align at the next meeting for a vote. So, and Todd, to your question, those two sort of concepts that you and Tess put forward are front and center in the work. So you were in the room. So that was good. The second piece that we talked about was around data and our requirement to obtain data and do community needs assessment. And Liz and Melissa and others made a suggestion, or we ended up talking about the process that the prevention work group and the school work group went with convening a work group of statewide stakeholders to sort of pick up this work or at least explore it. There's a lot of enthusiasm for that process. So we will pick that back up next month. And I think beyond that, Chastity, I'm not going to steal your thunder. So I think in your report, you'll cover a lot of things about grants and such, but those were the two big items, and we'll continue working on those and working those through at the next Program and Grants Committee. And I will get the minutes to the group. It's just only been March 31st, and I haven't had time, so we'll get those to folks. And I think that's it for me, Tess.
Thank you, Joe. Does anyone have any feedback, comments, questions for Joe or anyone on program and grants? I'm not seeing any. And so your next meeting is Tuesday, April 28th at 3:00?
That's correct. Everyone's welcome.
It's always a good time. Liz, do you have any updates or anything you want to share for the subcommittee on school funding?
Sure, it's brief. We're really working on trying to finalize up the report for you. We just, we haven't gotten there yet. We're working on it. Our plan is to have it for you at the next meeting.
Well, we appreciate all the work on that. Thank you, Liz. All right, so next up on the agenda, we have staff reports. Chastity has stepped out. Elizabeth, you wanna do anything you wanna?
Yes, I can start with, I know you all got Grayson's email about that they're no longer supporting the MRC. So that means a couple things for us going forward.
What do you mean?
Did you not? So Grayson is not gonna be helping us out.
Oh,
Yeah.
I apologize.
No, sorry, I hope that's like, I didn't give you a jump scare there, Paul. So for us, that just means that Chastity and I will be responsible for things like the agenda, posting, and meetings. And so if possible, we're gonna ask that you get those to us a little bit earlier than usual, just because we also know that Katrina has a lot going on, and so if we can get those to her before last minute, that's always helpful. And then you all received the new accessible templates for the agenda and the meeting minutes. And so if you could use those for the next meetings, that would also be appreciative. And I don't expect anybody to dive into them, but I'm happy to send the accessibility resources that we were sent. They just explain what we're supposed to be incorporating when we make those things that make it easier for screen readers to access things that we're using. So just like not underlining things unless it's a link. We're not supposed to use columns because it will jump across and read it as a block of text and things like that. Again, don't expect you to read all of those, but I'm happy to share. So in case you're interested in what we're looking for, but just going forward, we ask you to use those new templates, and then any materials that you want shared with the committees or the council, we ask if you can try to get those to us like 3 days before. Again, so if we have to do any formatting changes, but also so we can make sure you all have them with reasonable time to review them before a meeting. I know sometimes it's not always the most productive meetings if you get something like 10 minutes before and then we want to have a discussion about them. So anything we can do to support each other to make sure people have things with time to review, we would all appreciate. So that's all of that.
Thank you.
I'm going to build on administrative stuff. With that, with Daryl's job change, this came up recently, so it's going to be a reminder to everybody. If there is any substantive, not saying that word right, change, I can't get it out, in what you reported on your financial disclosure form, you need to let us know, and we do an updated one within 30 days. It's on each individual to do so. However, it's part of our, conflict of interest. But the challenging part is if we don't have an updated one, you can't vote and we can't count you as part of quorum. So just putting it out to everybody because that's never been communicated until we're learning it right now. So
if there's no real change,
if what's on file is still
probably within $1,000, is that a substantial change?
I wouldn't think so. But like a role, like if Maggie is no longer at Portland Public Health and she is at whatever, Maine Health, whatever, like that type of change needs to happen.
Okay, but, well, you said.
Substantive, yeah.
Okay, so if there's no substantial change, then you don't have to do anything and you're good to go.
Right.
Was my question.
Okay.
Thank you.
Jesse, who should we contact if there is a substantial change?
Reach out to either Elizabeth or I. We can give you the form and then file it.
I need one.
Mm-hmm. Brendan, you have your hand up?
Yeah, thanks. I think that was Betsy who was asking the question.
Yes, it was.
Folks might, excellent question, Betsy. Thank you. There's a little bit more information in the bylaws in section 7.3C. So I recommend you take a look at that.
Brendan, you're not gonna give us the keynotes?
Brendan.
You guys hear from me way too much.
What point 7?
7.3, paragraph C.
C is in Charlie.
Thank you, Brendan.
You don't have them on your phone?
7.3C, okay.
Oh,
Would you like me to read it?
Yeah.
Yes,
A
please.
council member shall submit an updated statement concerning the current calendar year if the income, reportable liabilities, or positions of the member or immediate family member, excluding dependent children, substantially change from these disclosed in the member's most recent statement. Substantial changes include, but are not limited to, a new employer that has paid the member or immediate family member, excluding dependent children, $2,000 or more during the current year. Another source that has provided the member with income that totals $2,000 or more during the current year, or the acceptance of a new position for a for-profit or nonprofit firm that is reportable under 5 MRSA 19(2)(q). The member shall submit the updated statement within 30 days of the substantial change in income, reportable liabilities, or positions.
And we
Thank
will
you.
put that in writing and send it to everybody with a copy so everyone has it searchable in their email.
And I'm happy to help out with, like, if it's a question of whether something is substantial or not. But in general, I think I would probably just advise that if it's even a question, I recommend updating the form in the interest of, more transparency is better.
A good question. And thank you, Brendan.
you still don't know.
Go ahead. No, I'm just thinking. If it's a substantial change, but please proceed. Pay no attention to me.
We'll talk after, but you can let me know what the change is and we'll see what we need to do. Volunteers of America. That's where we're gonna jump to next. So in your packet, there is a proposal that we received from them. We funded them previously in our open grant process for a 2-year award for a peer recovery coach within their recovery house in Scarborough. Of that award, $181,989, they received the first payment this past summer. To date, they have spent minimal, just over $2,000. They've tried to fill this position. They haven't been able to fill it. I'll see all of this background in this. They also had a recovery center in Waldo County, and they have shut down their recovery center after not receiving state funding and downsized. So they're still offering recovery coaching in the community and with the reentry center. So they are looking to see if there is a way that the council would be willing to work with them a bit and change what we are currently funding. We put out a few options of like what we see the 3 options are. One option is the council you can just terminate the contract. Say like, we're not gonna proceed with this. The other option would be to keep their contract for the same amount and change the scope of work. So instead of it being peer recovery coach in a recovery house that is no longer going to be a recovery house, it will be changing its scope in a few months. It would be peer recovery coaching in a different county, in the community, and in the reentry center. So same amount, change the scope of work. Or the third option is kind of like the in-between. They already have the year one funds that they only spent $2,000 of. Allow them to change the scope of work using those funds they have instead of returning them to us, and keeping the existing timeline on their contract. So they still have another year of their contract, but we won't give them their year two amount. So it would be reducing the award in half.
On that last one, did they say what the new activities would be that they'd spend on?
Yeah, yes, the budget right there. They gave us a budget. It's all coaching stuff. Yep. Yeah, let me share my screen. And that 88,000 that they have listed there, 88,815, that money is already gone. They already have that. That's already counted in all of our reports out that that's already out.
The purpose of the funds isn't changing, it's just the location, basically.
Yeah.
I really support working with them to serve the community. I mean, we're flexible. We're different than other funding sources. So I think if we think this work continues to be in alignment with our work, which I do, I think we should continue working with them, Chastity, to sort of do whatever we need to do to make it work.
It's already been allocated to them, so it's not an additional ask, it's a change.
It's just changing the scope, yeah.
But it's still recovery coaching, and I mean, they're looking to move it into a more rural county, so I support it.
Looks like there's three options. It sounds like one of terminating the contract. I've expressed interest in that, and then there's two others. Do you want to explain those just one more time?
Keeping the contract as is and just amending the scope of work to reflect the new work in Waldo County. So recovery coaching at the reentry center and in the Waldo County community.
I would move that we amend the scope of work and continue to fund
Second.
For the 2 years.
for the 2 years. Thank you.
And as someone that has done some work in that organization and or around that community there that they're speaking of, I do know that they have done tremendous work throughout the community, both in the reentry center and in a community center that has recently shut down. I just wanted to put that out there.
Thank you, Jamar, that's helpful.
Thanks, Jamar. We have a first, a second, any other discussion?
So that's the full award of
Option
the
2.
181,988.
Option 2.
Option 2.
Or, I think it's option 1.
No, option 1 is to terminate.
There's
Two different
versions,
Listings
yeah.
and they're not
On
aligned.
their proposal versus ours, so
Oh,
you're
okay.
probably right.
Okay.
Yeah.
Should have kept it consistent.
It's inconsistent. All right.
Forward. So we have a first, second, any other discussion? Betsy, will you please call?
Amber Pulsifer.
Yes.
I will vote yes. Deb Poulin,
Yes.
Jamar Williams,
Yes.
Joe Everett,
Yes.
Chris Blackwell Moore,
Yes.
Maggie McLaughlin,
Yes.
Paul Vinsel,
Yes.
Tess Parks,
Yes.
Todd Brackett.
Yes.
You have a unanimous vote.
Betsy?
Yes, ma'am.
Cassie, you have any other staff updates?
That's all the votes we technically needed, right?
I believe so. Yeah.
Well, the only other thing, this is kind of a more of an FYI. You want to pull up the SB stuff? So I know this is not anything you need to make a decision today, I guess is what I want to preface with. It is information sharing. So the annual report from the CDC is out from last year. So we don't ask any of the syringe service programs to provide extra reporting to us. We just ask them for a copy of the data that they send to the CDC. So instead of us having to reduplicate all of that, you get this very clear picture in the CDC report, and it is in the Google Drive too. It's very, very long. So brief picture. These are all of the syringe service programs that Maine Recovery Council currently funds. There are a couple, as you can see, like there's some notes on there. The 1-year ones, those were ones that when we had to terminate a contract, we redistributed that money. For the most part, it's pretty consistent that it was $75,000 per year per site over the course of 2 years. The outlier here, that Kennebec Behavioral Health, that was funded through our grant program. Gordon, I'm putting you on the spot. They still are not certified yet, right? It's being worked on.
They're still working.
Okay.
Yeah.
So that's a completely different amount. They went through our application process and they were funded for that full amount to get certified and build a program in Skowhegan. So that's like an outlier. So going ahead, when we talk about what we want to do, if we do something ongoing for syringe service programs, that will look vastly different than what they got their first time around. So total over 2 years, you're okay. It is 2.75 million that we've allocated to syringe service programs. Next one. So pulling from the annual report from the CDC, this is from all of the programs across the state. Like those are amazing numbers. But without even getting into each one individually, seeing the 51,000 referrals, that is anything and everything from medical care, housing, insurance, peer support. Like there's so many different things, and this actually worked out perfectly that Anna was able to join today so you could hear it a little bit more. And I actually think that naloxone number doesn't give a full picture either. Knowing that syringe service programs, they're getting the most out to the communities that are most likely to use it instead of it just sitting somewhere. Like, I think that is very low representation. But you can dig through 50 plus pages of the report and
68.
50 plus, I was close. And look at all the different programs. Like the numbers are very, very different depending on where you go. Like what Maggie's seeing in Portland, vastly different than what Chai's program looks like, but very deep impact. The last slide is just this is where we get into the state. So I had reached out to the CDC previously, and this is the information that they gave us. For all of their contracts, there's 6 funding streams that are all braided together to make up the awards for the CDC. 4 of them are federal funds, 2 are funding streams that are state funds. And looking at that amount, like year 1 total, 2.1 million, year 2 total, 1.74 for an entire state, like that's insanity. Like it feels so low in comparison with everything else, and that's what they have. They said, you can go to the next part because it'll show it. This is how it's all built out. The different pieces of what the funding source is and how they allocated it. They are not expecting any of it to go up in any way, most likely down. And as more programs get certified, that is less money for everybody. Like we obviously want more programs in every community, and that pulls away from the existing programs. So we'll make sure like this is in the drive too, so you can look into all the numbers, because I think it's going to give you a much better picture as you talk about and decide what you're going to do for ongoing and one-time funding to get that full picture. Then the last one is just where it is in the drive. You know. So that's it.
Thank you for that report. Anyone have any questions on the SSP reporting?
Oh, no, wait, there was one more. It wasn't SSP stuff.
Gordon has a question.
Gordon, he's gonna have a response more than a question, I bet.
Well, and I realize this isn't a public portion of the meeting, but I think that one piece, I agree with everything. I don't have a question, and it is a comment, but it's an extra piece. That's the history of this, that there was no statement from the late 1990s when the first exchange started until I would guess about 2017, 2018. And I was very much involved with that because State Senator Linda Sanborn, a wonderful retired physician, when she was in the state Senate, she presented the first general fund proposal and got, as I recall, at least $1 million. That was really the first substantial funding, but it was just for that period of time. And then we started using the prevention treatment program. So it's, you know, I think that's important to recognize that while this looks like not enough, it used to be 0.
I think it's both. It's definitely not enough. It's better than it was.
Yes.
And not only the council, the public needs to see the reality of what that money is,
right,
instead of thinking it's like this huge amount when people are surviving on pennies.
Right. It's up to all of us to sell it. I understand that. But there's a second. I could say a lot more about this after December, but I'll just, as Charles Barkley recently said, I'm going to choose my words wisely. And if you're a Saturday Night Live fan, you'll see they've taken quite a play on that. So choosing my words wisely, there is almost no CDC money in here. This, despite my starting to ask in 2019, put this in their budget. If this is an important program to you, you need to put it in your budget. They never have, they still don't, and it's very discouraging to me.
And that's the Maine CDC.
The Maine CDC, which regulates, certifies the program. They have no money in their budget for this. There might be a total, I mean, if it is, it's almost nothing. So the big money started to come from the Prevention and Treatment Fund. The legislature rated that recently, good purposes, using it for the treatment court up in Aroostook County. But that fund only that's what comes in from the pharmaceutical companies through the Board of Pharmacy over to HHS. It's not an OVH fund. It really, if anybody controls it, it's really the commissioner of HHS upstairs. And it's only in its best years, maybe a couple $1 million. And over half of that has been going to the syringe program. So when you saw, there was a comment on the slide there that said, not expected, prevention treatment fund, not expected to be as much in subsequent years. Well, that's somebody's opinion. And that will
Reported to me.
Yes,
CDC staff.
absolutely. And I understand.
Clear.
And we have, you know, the acting deputy director of OVA with us. And she can relay some of these comments, of course. But again, OVH, I think, it has become increasingly frustrated with me, saying that, well, why doesn't the office that actually certifies and regulates the exchanges, where are they in this mix? Because they're just looking over here and asking it to be funded over here. So that's very frustrating piece that over time, those of you over here over the next few years are going to continue to struggle with 6 funding streams, and thank goodness they're there. But it's disappointed me that it's not funding for this critically important program is not built into the state budget. We are patching it, taking this piece, that piece. And that's disappointing given how important it is. Thanks for letting me speak.
Gordon, thank you for that context. I think that's really helpful. And you know, we are in the worst HIV outbreak that the state has seen. The numbers are only going up in Penobscot County. And the opioid settlement funds, they do eventually run out. And we haven't really talked as a group what our contribution, if any, would continue for certain service programs. I know there's a lot of support for harm reduction. I think most of us understand, as Gordon said, how critical having access to sterile supplies. So thank you, Gordon. I that was something I did not know, that there wasn't a state budget line item for that. And to me, I will echo as individually, that's disturbing. Jamar?
Yes, thanks, Tess. I'm curious, and I know that I'm newer to the board, and so I'm just wondering, and looking at the numbers and hearing the reports, is there some type of report that reflects the number of children that are impacted um, from those from folks that are using SSP or um, fatal overdoses or anything of that nature?
I wonder if this is almost like some of our best data is from Minus and like some of the information around ACEs that is more broad.
I guess, could you
I c-
you narrow down what you mean by impacted by? Because that can mean a lot of different things. I'm trying to figure out where we might be able to get you some numbers.
Right.
Yes, thanks for asking for that clarification question. So as I'm looking at the numbers and seeing amounts of money that has been spent in different areas, um, and I'm and then also thinking about the overdoses that has happened over the years, especially since I think it was 2019 or 2020, where they really took a spike. I've just been wondering how many children have lost a parent, or how many children um, have a parent or both parents um, that are currently using substances. And I just wanted to think around, is there some type of report that reflects the number of children in those situations? And I'm looking at that through the lens of ACEs, because I know that when I look at reentry and understanding, say, for instance, there may be for every person that's incarcerated, that may be reflect 3 children that are impacted. So I'm just wondering if there has been some report to that effect here at the Recovery Council surrounding substance use. Does that make sense? Or
Yeah,
is that-
no, Jamar, that does make sense. I think those are some really good questions. I don't personally, off the top of my head, know where we could find that data, but I'm sure amongst us, there has to be. Gordon?
So I think for Maine specifically, the place I go is OCFS because they deal with children and we know that half of the cases, more than half of the cases that OCFS involve with children involve substance use. But that would still not be a complete picture. But about 3 years ago, the RAND Corporation did this fantastic report that took, it was entitled maybe the opioid ecosystem. And it, say it's 20 chapters, it's 400 pages. I'm probably the only person in America that has printed it out. So that once in a while I could take it, it's a fantastic report because each chapter deals with the impact of substance use and opioids on a specific population. And there is one on the impact on children. And there is great national data that you could loosely extrapolate from, but that is the best piece that I've ever seen. Because there's also a chapter on the impact on public education, the impact on law enforcement, the impact on criminal justice. It's just fantastic. And I have that chapter printed out. So I'll take another look at it, see what might be helpful to Jamar and forward that through you.
Yeah. Thank you, Jamar, for that.
You're welcome. And I guess the reasoning for my questioning is because understanding, having the foreknowledge to know that these funds will not be there forever. And the children that are children today are undergoing some of the ACEs, the adverse childhood experiences, and those children will grow up. And so they're going to be they're children today, and they're on the receiving end. And someday they're going to be adults themselves. And so in an effort to get ahead of it, and utilize the funds in a manner that will be consistent to having a healthier or trying to have a Maine where we've took steps to kind of mitigate what's happening currently, to be proactive, so to speak. Is that making sense? It's just making me start thinking around a preventative space a bit more.
That
Liz.
makes a lot of sense.
Yeah, I do think we're in this interesting moment where like with I think we have some continuing to do some communication around what these funds are for and their ability to do some things, and also their the limitations that we have. And so I know we say it a lot, but I think perhaps we need to like write it down a little bit. I mean, I think this passing off of where does the money come from? So like if it never got put, if harm reduction money never got, or syringe service money never got put in the Maine CDC budget or in DHS's budget to Maine CDC, you know, like where's the disconnect there? And is there thinking amongst them that the Recovery Council will handle that? I think I hear folks being like, well, there's so much money there. What are you all doing? And it's like, we can't solve, no one of us can solve it. And so, you know, that money that Gordon was talking about, that's for treatment and prevention, it's never, ever, ever gone to prevention. Never. Like it's never been allocated to prevention. It's only allocated to harm reduction, like overdose prevention or treatment, but it's never gone to prevention. And we don't have actually any money in the general fund budget that is for substance use prevention. $0 come out of, I know I've said this here before, but I'm going to say it again because you've given me a platform. $0 come out of the general fund for substance use prevention. Any money that we have that gets spent here in the state comes from the federal government, which is all at risk and in jeopardy. So I do think we have if there are ways we can continue to provide folks with like, this is great money for certain things and it will end. So you just made me think of it again, Jamar, and I appreciate that because I think that's partly what, when we did the school work group, hearing about all the ways in which children have been impacted, are just massive. That is going to take massive investment in a whole host of things, not just like prevention services, but in a whole host of things that happen out in community.
Thank you, Liz. Anyone else have any feedback for the question that Jamar posed?
No, but I'll move. All of you on Zoom missed out a little bit here. Mayan sent like beautiful printed impact reports for each of you. So that way you could have it, you could read it. They're gonna come to our meeting next month. So they wanted you to have a chance to read it beforehand. I will send you a digital link. I don't know if they've got it all formatted. I'm assuming they do. I'll get it to send that to you. But if you want your hard copy before the next meeting, send me your address and I'll throw it in the mail and get it to you ASAP. Like they are.
We can carry them back for any Portland people.
Portland folks, do you want Maggie to bring it to you? Joe, you weren't for them, but. All right, well, that's what I've got. Other than that, go ahead.
Maybe we can have a contract with one of them? Yeah, sure.
Sorry, we have 3 different things going here.
I think the contract updates, I think we're finally closing out the drafting process of the contracts that were awarded in that grant process, with the exception of the prevention contracts. So like the 2Gen and the school, what comes of the school, that is not, I'm not including that in this. But so we have a couple more, and we're hoping to get all of those out before the deadline with our finance department for the end of the year fiscal year deadline. So before July 1, we're hoping to get those out. So we have the Recovery High School, York County, and then PCG actually just signed their contract. So that will roll into our reporting conversation. And so the second reporting window closes or the due date is the 15th of April, and that's for the period December through or October through March. And so that's a lot of information. And so getting kind of anxious to have them, our PCG, onboarded to help manage the collection of all that data. And I think also maybe help us back out a little bit of where we've gotten ourselves into with this reporting. I think we, in our template, have collected a lot of good numerical data in terms of what they're actually doing. But I think, at least I'm hoping that PCG can help support us in collecting much more of the broader picture. That'll be much easier for us to present to you all in terms of what these programs are achieving month to month, and even in those quarterly reports. I know those numbers are helpful to have, but I also know that the larger picture is helpful. So I think we're gonna hopefully have some conversations about how we can do, all of the things at once and make sure that our data is aligning with what we need to collect in terms of the abatement strategies. But it's not also so small that we're, collecting such niche things. But we can help hopefully collect these bigger pictures that help everyone get a sense of what is going on, because they're doing a lot of great work that we're really excited for you all to hear about. So what was that?
On contracts, the recovery centers. Because we talked about it in committee meetings, but the full report hasn't come here. We met with the Attorney General. He's interested in doing something for year 2. What that something is still to be determined. So we've been trying to figure out the mechanism of how to do this all together, and where we have landed now is, yes, it can be a single contract. Because of the blackout periods, we are looking at processing year 1, just doing it so we can at least get ours out, and Brendan's helping us with language to put in there. So once the Attorney General comes on board with whatever he wants to do, it can just be an amendment to add it in, but we don't have to hold everything up to wait and hear what's going to happen for year 2. So we're really trying and hopeful to have it done for this fiscal year so it can go out as soon as possible. And not likely an amendment like we were hoping to do for the ones that we already had a contract with, because of the potential of braiding the 2 funds.
That's great to hear. I know the timing for that item in particular is really important to the council, that we get this money to them, given that, many had reported possible closure without this. Any other staff updates, questions?
Just really quick, Liz, thank you for sharing that report link. I'll add that to the Google Drive, everyone, so you have access to it.
Elizabeth, and do we have any new business for the council? Not seeing any, so we will adjourn this meeting. Thanks, everyone.
Thank you.
Thank you.
Everyone on Zoom.